Can everybody hear me? Okay. As a child, pigeon begonias always struggled to conform to society's expectations for them. They never truly quite felt like they fit in with the other girls their age. They always felt different, in a way. And as their early adolescent years rolled by, these questions were not answered and these concerns were only heightened. It wasn't until early adolescent years that they finally discovered why they truly felt this way in youth. And that is because they were born an intersex child, however they were raised as a girl. They had their internal testes removed, and they also had other non-consensual intersex genitalia mutilation surgeries performed on them. You can imagine how jarring they felt, how betrayed they felt as they realized they were lied to numerous healthcare professionals. They were lied to by their parents, and their medical history was just filled with fabrications. According to Human Rights Watch, July 25th, 2017, 60% of individuals reported to have experienced significant traumas later in life after receiving these non-consensual intersex surgeries. And this is why Congress must address the issue of these non-consensual intersex mutilation surgeries. Today, I will explain the problem of these non-consensual intersex mutilation surgeries. I will explain the long-term health effects, how it violates bodily autonomy, and finally, how it impacts gender identity. Finally, I will discuss the possible solution if Congress were to pass a law that bans these intersex surgeries. We have a serious problem, like I said, and it is these non-consensual intersex surgeries. First, let's look about what these surgeries even are. According to BMC Medical Ethics, July 24th, 2019, these surgeries are performed in order to normalize the appearance of an individual's genitalia to better fit society, what society expects from what should be a female, what should be a male. And parents aren't quite informed enough and under this stress, they allow the doctors to easily sway them into letting it happen. Now, what does intersex even mean? According to the Cleveland Clinic on May 1st, 2024, people who are intersex do not strictly fit into the sex category of being either male or female. This is because of the difference in their genetic their genes. Some of the intersex people have XXY chromosomes. Their genitals may look different. Some people may have the appearance of a vulva, except they might not be born with a vagina. And the internal reproductive organs. And when you say intersex, you aren't referring to a specific condition alone, but you're referring to a wide term of biological variations. There's many different variations of people who are born with intersex traits. Now, these surgeries are very, very common. According to Human Rights Watch, July 25th, 2017, there are about 1.7% of people who are born intersex. Now, this may not seem like a lot, but that is approximately 136 million people. Thousands of those have had surgeries similar to pigeon begonias. Now that we know about the problem with these non-consensual intersex surgeries, let's discuss their lasting effects now. There are 3 significant effects, like I listed in the beginning. There are the health consequences of psychologically and physically, how it violates bodily autonomy, and finally, it impacts gender identity development. Non-consensual surgeries on intersex individuals often result in lasting physical harm, such as chronic pain for life, scarring for life, loss of sexual sensation for life, and even infertility. This is a very serious problem. A lot of intersex individuals lose the right to have babies. If you have the appearance of a woman and you have the hormones that these women feel, you want to give birth to babies. But this is not a reality for a lot of people. And sex is something that a lot of people enjoy. Imagine having your sexual sensation gone forever. This impacts you for a lifetime, and it's something that could have been prevented at youth. According to BMC Medical Ethics, many intersex individuals report trauma, anxiety, and depression stemming from these early medical interventions. These are psychological traumas that harm these individuals. Additionally, according to Human Rights Watch, October 26, 2017, the emotional toll of these surgeries is profound, with many individuals feeling just disconnected from their bodies due to procedures. It is truly unfathomable if you have not experienced it for yourself. These long-term health effects are both physically and emotionally damaging, which influences a person's overall quality of life. They have to deal with this day to day. This is something that we cannot understand. It's something we can only accept and truly try to understand, and we can try to make a change from it. Furthermore, performing these irreversible surgeries on intersex infants, it violates the right to their bodily autonomy. According to Human Rights Watch, October 26, 2017, these surgeries are often carried out with the individual's ability to provide informed consent because they're babies. They are infants with barely any sentience when their whole life is changed forever. The United Nations has called such surgeries human rights violations, because it is, emphasizing that children have the autonomy to decide whether or not to undergo such procedures later on in life. Surgical assignments of gender can conflict with an individual's identity as they grow up, leading to identity and confusion. A lot of people, many intersex individuals, do not agree with the gender that they were assigned to at birth. They're forced to take hormones for the rest of their life when their body naturally already produced the hormones. Now they have to pay for the hormones and take them every single week. That's just so upsetting. After reviewing the many effects of these non-consensual intersex genital mutilation surgeries, let's discuss a possible solution of passing a federal law that bans these surgeries. Congressional action needs to be taken to ban these surgeries. The clearest and most effective solution is to pass legislation that bans these non-consensual surgeries, at least until consent can fully be given. And it's not like it's asking for a lot. Consent can be given a couple years later down the road. This would provide the intersex individuals' right to their bodily autonomy. Such a law could include provisions that delay surgeries until consent can be given. Like I said, this approach also respects the fundamental rights of their autonomy. I can't stress this enough. That is just extremely important. Imagine how you would feel if the rights to your bodily autonomy were just taken from you at birth. That is horrible. According to Human Rights Watch, October 26, delaying these surgeries until consent can be given prevents lifelong physical and psychological harm. This federal law should also mandate education for medical professionals and parents. Like I said in the beginning, parents are not informed enough. They make these rash decisions because a medical professional tells them, when the medical professional isn't even educated enough as well. Intersex advocacy organizations such as Interact Advocates 2024 emphasize that informed decision-making reduces the pressure to normalize intersex traits surgically. Education about intersex individuals should be more accessible and prevalent. Right now, it is sort of a negative stigma. It's not talked about enough. When, like I said, 1.7% of people are born intersex. That's the same amount. That's the same percentage of people who are born with natural red hair. And I've seen a lot of natural red hair people in my life. It should definitely be talked about enough. Instead of altering individuals surgically with cosmetic surgeries that are not necessary to conform to societal norms, we should focus on reshaping societal norms to embrace this natural diversity. Today we learned about why Congress must address the issue of non-consensual intersex genital mutilation surgeries. We looked at the problem of these non-consensual surgeries. We looked about their long-lasting effects, how it violates bodily autonomy and impacts gender identity, and finally, we discussed the possible solution of the law that could be passed by Congress to ban these surgeries until consent can be given. Remember, Human Rights Watch, July 25th, 2017, 60% of these individuals have been affected and experienced lifelong harm. Just like Pigeon Pagonis, one of the many individuals, while they've accepted their fate and are currently an intersex advocate and activist, their story should remind everyone of the harm that could have been prevented if these surgeries were only postponed till consent can be given. Thank you.